Good afternoon, everybody, and welcome. Oh, sorry. Go right ahead, Congresswoman.
You go ahead, Connor.
Well, sorry for that, y'all. My name is Connor, and I work with Congresswoman Houlihan. I'm going to be moderating our town hall today. For anyone who has a question at any point throughout the call, please press *3. Again, press *3, and you'll be directed to a member of Chrissy's staff who will take down your question and enter it into the queue. Again, so at any point during the call, please press *3. And with that, I'd like to welcome everyone to our Medicare Open Enrollment Town Hall and hand it off to Congresswoman Houlihan.
Thanks, Connor, and sorry for talking over you. Good afternoon, everyone, and thank you for joining our telephone town hall today. As Connor said, focusing today specifically on Medicare Open Enrollment. And there certainly isn't anything more important to me, and I know to our community, than the health and well-being of each one of us. And since coming to Congress, the number 1, 2, and 3 issue in our community has been health care. And it has really only become even more apparent as being crucial as we continue to face this COVID-19 pandemic. Today's call, as I mentioned, is about Medicare and Social Security, but it is also important to update you a little bit on what's going on in COVID relief package. I sit here speaking to you right now from Washington, D.C., and I'm committed to sitting here until there has been another COVID relief package passed. We've been working really diligently on that since the May timeframe here in the House, and I am very hopeful that enough positive momentum is happening on both sides of the House and the Senate and with the White House as well, that I'm hopeful that we'll be able to see a successful package, if anything, an interim package between now and the next administration. So today I wanted to make sure that our community has access to information surrounding 2 specific programs, Medicare and Social Security. And so today joining me are CMS Philadelphia Regional Administrator for the U.S. Department of Health and Human Services, Sharon Graham, and Public Affairs Specialist at the Social Security Administration, Edward Lafferty. And so we have a ton to cover, and we got a little bit of a late start. So I'll now hand it over to Sharon Graham for some opening remarks.
Thank you so much, Congresswoman Houlihan, and thank you for having me today on this teletown hall that's so important for your constituents. I also want to point out that I have joining me several other specialists that will be able to answer all questions related to Medicare today that might come up. But I just want to take a brief moment to emphasize that we're nearing the end of the annual Medicare open enrollment period. And this is the one time a year that people with Medicare can sort of take a step back and review their health care coverage to make sure that it still continues to meet their needs. Because we know that plans will change, benefits sometimes change, out-of-pocket cost sharing will change, and of course people's health status changes. So it's so important to take that time right now to make sure that you're in a health plan or that your original Medicare is still covering you for all that you need and that it still meets your budget. One thing I really want to highlight that's an important change for those listeners, those constituents today here who are insulin-dependent diabetics, and about 1 in 3 people are in fact insulin-dependent, is we have a new Medicare option available for people where hundreds of plans across the country, and in Pennsylvania, of course, as well, are offering insulin for no more than $35 a month. And that's a really important savings for people with Medicare. We feel, in fact, that people will save on average about $450 a year if they enroll in a health plan or a prescription drug plan that offers that coverage. And it's so important for people to be able to have access to insulin at a cost that's right for them. And also really important, I'd be remiss if I didn't mention that we're in the middle of flu season. And it's so important for people with Medicare to get the flu shot because the flu is especially dangerous for people with Medicare. It can lead to a lot of serious complications. And so we want to encourage all people with Medicare to get their flu shot and know that it's 100% covered by Medicare, that you won't pay a single penny out of pocket to get the flu shot. So please take the time and go to your local provider, use all social distancing precautions, wear a mask, perhaps go to a pharmacy where there's those vulnerable population hours that are set aside, but please go get your flu shot because no year is more important than this year to make sure that you have that flu shot. So with that, let me turn it back over to you, Congresswoman. I appreciate the time.
Of course, and thanks very much for that really good set of opening remarks. And now I would like to turn it over to Mr. Edward Lafferty for a similar set of opening remarks. Thanks for joining us.
Well, thank you, and I want to just say the same thing as Ms. Graham did. Thank you so much. It's really a pleasure to be able to be here. I just want to mention two things that are really important in terms of Social Security and for everyone, and whether you're on Medicare or not. As of March, Social Security offices closed to in-person appointments, in-person service. And the reason, obviously, is because of the population we serve, older Americans, people with underlying medical conditions, because we do have a significant number of people who are disabled. And coming into the office, they are individuals who are most at risk. So, yes, we are closed to the public generally. However, we're still able to provide critical services and really want to get the message out. Please let everyone know, particularly people in certain kinds of vulnerable populations who might not be aware, that they can still contact us. Number one, we really want to highlight the My Social Security account, going on the Social Security website, creating an account. The reason for it is that whether you're on or not, there are so many things you can do, but especially if you're on Social Security. And when I say on, I mean you're getting benefits, you've actually applied, you're enrolled in Medicare, or you've actually are getting cash benefits through retirement, disability survivors. And the point is, you can get a replacement Medicare card, a replacement Social Security card. Note, I say replacement. You can change your address, phone number, direct deposit, do an advanced designation of a representative pay, do a range of things. But most important is, if you wanted to apply for benefits, including filing for Medicare or retirement, you can do that online through the My Social Security account at socialsecurity.gov or ssa.gov. And I highlight that, obviously, because we're not talking about .com or .net or .org, but it is your tax money at work, one of your websites, socialsecurity.gov, and really to go there and create an account. If, and obviously not everyone can go online and not everyone can get every answer online, you can still contact a local Social Security office. You can actually get the local phone number. Now, it is one that you have to get online, but in fact, you look for our field office locator, you put in your zip code, and you'll have the general information line for that office. So almost everything can be done by phone. We hope you can do it online first. If not, try the phone. And we also have the 1-800-772-1213, our general number. There are some issues in which people need to come in. They're in dire need for specific reasons, and they can make an appointment in an office. However, it's a very specific protocol. Our management would set the appointment up, so we don't want someone just to go to an office and knock on the door. But in certain dire needs, yes, they can respond. And finally, I do want to mention, if any of you have received one of those scam calls, we still get these, and particularly now because of the enrollment period. So many people get contacts from individual robocalls or individuals who basically say there's something wrong with their Social Security number, with their account, you need to contact us. And I just want to highlight, Social Security employees will not threaten. Do not ask for gift cards. Don't say send us money now or anything like that. If you have any issues, please do not engage with these individuals. It's a terrifying thing for people who have not contacted a Social Security office in quite a while, and suddenly, out of the blue, they're contacted and told there's something wrong. So please, be aware of that. Scammers are always on the march, apparently. But those are the three things I wanted to highlight, and thank you so much.
You're welcome, and thanks so much, Sharon and Edward. And before we do start taking questions from our callers, what we normally do is start with a few questions that seem to be pretty prevalent amongst our constituents. And Sharon, the first one's for you, and you sort of touched on it in your opening remarks, but I think it bears repeating. Why is open enrollment important for people with Medicare, if you could kind of capture that?
Oh, definitely. This open enrollment is so important for people with Medicare because it's the one time of year that every person with Medicare has the opportunity to take a look at the health care that they currently have in place and determine if it's the right health care coverage to meet their needs. We know that everybody's health situation can change, and every year Medicare Advantage plans will change. Cost sharing will change both for original Medicare as well as for Medicare Advantage plans. So it's so important to review your health care coverage now. Look at the options that are out there for you and make sure maybe it's your current option and it still satisfies you. And of course, you can definitely keep what you currently have. But it might be time to make a change to better suit your budget or your health care needs. And it's important to make that decision no later than midnight on Monday, December 7th, because after that, our open enrollment season closes. And for most people, that means that changes will not be able to be made until the end of 2021 for benefit changes effective in 2022. And that's a long way away. So people need to take advantage of the open enrollment period right now.
Yeah, and I thank you, Sharon, for that really good answer. And I will tell you that we have had more than a few constituent cases in my first couple of years here that have been exactly that situation where people missed that open enrollment period, and the consequences are not awesome. And so, do take the time. We've got a few days to go where we can really make good decisions and do make that choice while you can. The next question is for you as well, and it is kind of who can participate in the Medicare open enrollment again.
Well, sure. Medicare open enrollment is for anyone who has Medicare. And for most people, that's beneficiaries who are over age 65, although other persons who are younger than that but who have been determined to be disabled by Social Security will also be eligible for the Medicare open enrollment. And this is the open enrollment period is for anybody who has original Medicare or might be enrolled in a Medicare Advantage plan. Again, it's for everybody. And in Pennsylvania, that's approximately 2.6 million people who should be looking at their health care coverage at this time.
Perfect. Thanks. That's perfect. And Ed, will Medicare be deducted from the Social Security check? That seems to be a very common question.
Yes, that is, yes. And that is the points that most people are quite familiar with. We're the point of contact, and in fact, the distinction between Medicare and Social Security, individuals do come to Social Security, but obviously we're a separate federal agency from the Centers for Medicare Services, and so we are the entity you enroll with. And when they sign up with Social Security and they enroll in Medicare, it does come directly from your Social Security benefit on a monthly basis.
Perfect. Very much appreciate that clarification. And the last kind of question that is a general common question is for you as well, sir, and it is, how do you appeal an income-related monthly adjustment amount decision?
You can go online. I will keep repeating to this, on Social Security, and there is a form. I know, but there is a form, and in fact, we can even mail the form to you if it's impossible for it. Obviously, I keep bringing this up, but there are people who, because they don't have broadband, infirmities, disabilities, language, etc., might not be able to do. You can call the office. We can send you the paper form, but you can do it online. You can print it out. It's a number 44. You can actually appeal. Before you appeal, though, you really should contact our Social Security office. And in fact, this past month, letters went out verifying that, because we do an interface with the Internal Revenue Service. And so you might be getting a letter that says, you will owe more because of your past income. But any life-changing event, something different might have taken place. For example, you stop work, and so you're not making the same amount. You can contact us, and oftentimes we can change the decision. But either way, there is a form available. It's all you have to do is go on our website. At the bottom it says Forms, type in 44 or Medicare. It will come up, and you can submit that and any proofs that are necessary. And most of the proofs that are necessary are already available online. In other words, it will guide you through what do we need from you in order to establish some sort of change.
Perfect. Excellent. The old Form 44 is, I think, is what you were emphasizing.
Yeah.
I come out of a military background, and there's always a number form for something. So, well, that's still kind of the general questions. And now, if it's okay, we'll go back over to Connor, who has collected some questions, I believe, from online, and perhaps also has some dial-in questions as well. So I'll turn it over to Connor.
Yes, so our first question today comes from Barbara in Westchester. Barbara, you should now be on the line.
Thank you. My question is this. I'm just a little confused at the procedure. I turned 65 in March, so that's in 3 months, and I'm still working, so I won't be getting a Social Security check. So one, how do I get how do I get a Medicare number? And then how do I apply for my Medicare?
Sharon, would that be a good question for you?
Well, I was wondering if Ed wanted to start, since Barb has to first apply for Medicare, and that's through Social Security.
Perfect.
Exactly. Didn't want to cut across you. You can actually apply for Medicare online if you wish. And in fact, it's just create the account, you apply online, and basically just process through there. So your first thing is you do need, in order to get the Medicare number, you have to apply for Medicare. However, if you are continuing to work and you're only applying for Medicare A, not Medicare Part B, if you're familiar with that, because you're covered by your employer group health plan, you could delay signing up for Part B if you wish. So the information is basically on our website about applying. So there's a pamphlet, there are plenty of fact sheets explaining all of it. But the first thing you'd have to do is to apply online. You do that on the Social Security website, not on the Medicare website, because we do that enrollment. So all you have to do is really just go on our website and, in fact, look under menu for Medicare, click it, apply for Medicare, and you can go from there.
Thank you
Excellent.
so much, Barbara. Oh. Go ahead, Congresswoman.
Go ahead, Connor.
Thank you so much, Barbara, for your question. Our next question is actually someone submitted this from a constituent call earlier. It comes from Dante in Downingtown. He says, I'm turning 65 soon. Where can I find more information on specifically my options for Medicare coverage?
Hi, this is Sharon Graham with CMS, and I'll take that question. Right now, especially during open enrollment, this is a great time to be reviewing your options for 2021. And we have some great places that people can review and read about more with Medicare, just from the safety and security of your own home. So first, I would point Dante, as well as all of our listeners today, to the Medicare and You handbook, which you should have received in late September. Every household gets one every single year. And that's a great handbook that goes over all of the Medicare options. And at the very back of the book also describes those health plans and prescription drug plans that are available in your local area. So the Medicare and You handbook is a great resource for people. For those constituents who are comfortable on the computer, our website, which is medicare.gov, is an excellent resource for people to turn to. And you can do a plan comparison right there from our homepage by clicking one button and answering a few questions, and then you'll be able to get a personalized list of those plans that are available to you in that area, with their premium amounts, out-of-pocket costs, and the benefits that they cover. So again, that's medicare.gov. And the third place to go for information and assistance is to our phone number. That's 1-800-MEDICARE. 1-800-633-4227 is the number. And at 1-800-MEDICARE, we have customer service representatives who are available 24 hours a day, 7 days a week, to answer any questions you might have about Medicare. And they can also help you with a personalized plan search there and walk you through the enrollment process and even enroll you right there on the phone as well. So those are three great resources: 1-800-MEDICARE, medicare.gov, and of course the Medicare and You handbook.
Thank you, Sharon, so much. Again, everyone on the line, you can press *3 to be entered into the queue. Again, that is *3 to ask a question. We have another submitted question. This one is from Harry in Kennett Square. He asks, I'm still working and I have private insurance, so I don't really need Medicare. What happens if I do not enroll?
Ed, would you like to take that, or would you like
Yes.
me to?
No, I'll answer that. I didn't want to cut across you on that. But basically, if you are under, now again, if you are working, continuing under your employer group health plan, or if you retired and you are in the employer group health plan of a spouse, someone has to be working, you can delay applying for Medicare Part B as long as you choose. And in fact, you don't even have to apply for Part A if you choose not to. You've already paid for it. There's no penalty. But the penalty that applies to Medicare Part B when you are late in enrolling in Part B would not apply in this case. You can delay as long as you like. When the time comes when either your employment ends or your health plan changes, you have an 8-month period in which you can apply for Medicare Part B, and there'll be no penalty assigned. In other words, you'll be paying the same premium as everyone else, baseline, whatever that monthly premium is. But in most cases, particularly because it was brought up earlier about the enrollment for private insurance, almost every insurance, all insurances are going to expect you to actually have already applied. So we do tell people, contact us about 2 to 3 months before, say, you're stopping work, so that you can tell us when do you want Part B to begin. One qualifier here is we will need information from your employer, generally, or information showing that you were working from the time you were 65 on to the time you're actually now enrolling. So say you waited until age 68 and now you want Medicare Part B. In order not to have a penalty assessed to you, you would have to establish that. And typically we get it from an employer showing, yes, you were under their employer group health plan. But the point is you don't really need to do anything as far as Medicare is concerned if you're happy with your health insurance, it's comprehensive, you're knowledgeable about it, it works well for you. You can delay, and there would not be a penalty.
Excellent. And thank you very much for that answer. And Connor, do we have any other questions either on the queue or from online?
We do. And again, y'all, it's *3 to ask a question, but we have Gabrielle from Wyomissing on the line. Gabrielle, you should be live now.
Hi, I am calling because my uncle's been recently hospitalized and he's in rehab. He's not able to make any changes or look at his things right now before open enrollment closes. But we feel that his secondary insurance needs to probably change, and I'm not sure what I need to do to be able to make that happen for him.
Mm-hmm. Hi, and this is Sharon Graham from Medicare.
Go ahead, Sharon.
Hi. I wanted to see if perhaps one of my colleagues, Sammy or Monique, might be able to address that question.
Sure, this is Monique. Well, we're sorry to hear that your uncle was recently hospitalized, Gabrielle. That's a great question. If there are extenuating circumstances, we can consider on a case-by-case basis. My question is, and this, you say secondary insurance, there are different times you can change types of insurance. So if you're talking about a Medicare Advantage plan, that is what we're talking about for December 7th. But if you're talking about a Medicare supplement that works with original Medicare, that's a lettered plan like A or M or C, they're not tied to this open enrollment period. You can change them throughout the year. So hopefully that helps, but if you have any more specific information, please feel free to give it to the Congressional office, and we can follow up with you as needed.
Absolutely, and we'll be happy, if you want to stay on the line, we can take your information to make sure that you get a perfect answer. Appreciate the question, though. Connor,
Thank you,
back
Gabrielle.
to you.
Great, we've got another one that has been submitted, and the question is from Ainsley in Reading. She goes, I only want Medicare Part C and Part D. Do I still need to enroll in Medicare Part A and B?
And hi, Ainsley, that is a great question that we always like to make more clear for people. When everybody becomes eligible for Medicare, you automatically get what we call original Medicare, and that's Medicare Part A and Part B. A Medicare Advantage plan, it is your Medicare. You're just choosing to receive your Medicare through the Medicare Advantage plan. So you do need to have Medicare Part A, which I believe Ed pointed out doesn't have a premium for most people. You do need to pay the premium for Medicare Part B, and then it's your choice to enroll in a Medicare Advantage plan, which may or may not have an additional premium associated with it, but it's important to know that you still have Medicare. You're just choosing to receive your Medicare benefits through that private Medicare Advantage plan. And in Pennsylvania, I'll point out there's about 245 Medicare Advantage plans that you can choose from right now in 2021 before the end of the open enrollment period on Monday night.
Hi,
Thank you, Sharon. Go ahead.
Yes, this is Monique. I just wanted to add, if you want to have Part C, which is Medicare Advantage, you are required to have both Medicare Part A and Part B. So if you're looking into do a Medicare Advantage plan, you have to have both A and B. If you want a Part D plan, as in the prescription drug plan, you do not have to have A and B. You just have to have one part of Medicare. So I hope that helps. I know that it's not the same for both parts of Medicare for C and D, but one has to be on the program. But A and B are required if you need or are interested in enrolling in a Part C plan. For Part D, you just have to have at least one part of Medicare. So you're not required to have both A and B if you want a Part D plan.
Mm-hmm.
And we actually have a question that is similar to that had been written in from Carlson in Wyomissing. He asked, what is a Medicare Advantage plan and how specifically does it differ from the more traditional Medicare?
So, and again, this is Sharon. A Medicare Advantage plan, well, let me take a step back. Original Medicare, Medicare Part A and Part B, that is what we call traditional Medicare, and it's what most people understand in terms of health insurance. It comes with a monthly premium and with deductibles and co-insurance that you pay out of pocket. Medicare Advantage are private companies that the government contracts with to administer your Medicare benefits, but typically those are health maintenance organizations, HMOs or preferred provider organizations, PPOs, and they will have an additional premium sometimes, not all the time, associated with them. You're agreeing to receive your Medicare benefits through that Medicare Advantage's network of doctors and hospitals for everything except an emergency. So you're agreeing to get all of your healthcare services through their network of doctors, and typically there will be a flat out-of-pocket cost called a co-payment. It might be $10, $20. Sometimes it's a percentage, depending on the plan. But again, the key difference is that whereas in original Medicare, you will have an open network of doctors that participate with Medicare. With the Medicare Advantage plan, there is a network of doctors that you're agreeing to receive your services through.
Thank you so much. It looks like we have Ed from West Goshen. Ed, you are on the line.
Okay, thank you very much. Just want to follow up. If I'm over 65 and still employed, so I have employer coverage as well as Part A coverage, when medical expenses are incurred and submitted, which plan is the primary for paying out the benefits?
Hi, Ed. This is Sharon Graham. And while you continue to remain employed and have employer-sponsored coverage, that will be primary to any Medicare coverage you might have.
Okay. And if for some reason the Part A coverage is better than the employer coverage, do I just submit it to Medicare, or is that something that's done by the provider?
Mm-hmm. The employer will always pay first, and then we would crosswalk it to Medicare for any additional coverage.
Okay, thank you.
Mm-hmm.
Thank you so much, Ed. We have another question that's been written in, and again, for our callers on the line, *3 will put you in the queue. Sorry about that. Martha from Reading asks, I decided not to sign up for Part D drug plan when I first qualified for Medicare when I turned 65 last year, but now I want to enroll in a drug plan during the Medicare open enrollment period. Can I do that?
Hi, and again, this is Sharon. Yes, this is the time to enroll in a prescription drug plan before midnight on Monday, December 7th. This is our open enrollment period. So I would encourage you to go out to our website, medicare.gov, check your Medicare and You handbook, or call our 1-800-MEDICARE number to review those prescription drug plans that are available to you and to make a choice before midnight on Monday, December 7th.
Mm-hmm.
Perfect. Thank you. We've got a few more that have been written in here. Francis from Phoenixville says, if I used healthcare.gov to sign up for health insurance last year, why am I being told to use penny.com this year?
Hey, Sharon, this is Robin. Hi, everyone. This is Robin from CMS. Last year, the state of Pennsylvania was an exchange that used the federal system platform, and this year it's going to a state-based exchange. And so your coverage will no longer be through the marketplace on the federal side of the house. It will be all handled through the state of Pennsylvania, which is why you received the notification probably from the marketplace back in September, as well as information from your health insurance plan, letting you know, and then also I know Penny also sends out notification as well, letting you know that your needs for your plan year 2021 coverage will all be handled through Penny, and so that's why you have now gotten that information. So this open enrollment, you'll need to do all of your open enrollment information through Penny and not through the health insurance marketplace as it has been in the past, unless you find that there's an issue with your 2020 coverage, or as you get into next year and you start to file your taxes and you need some information to be corrected on your Form 1095A that you receive, then you will come back to the health insurance marketplace for your plan year 2020 coverage. But for this year, for next plan year 2021, it will be through Penny, and that open enrollment, just for your awareness, is from November the 1st, and it goes through January the 15th of 2021.
Robin, thank you for that clarification. If somebody from Pennsylvania didn't get that notification through whatever format they would have gotten it and goes to healthcare.gov, what happens? Do they get redirected at some point to penny.com?
If they are calling about 2021 coverage, they should be redirected to go to this to Penny. If it is about their 2020 coverage or any previous coverage that was through the health insurance marketplace, then that call center representative should be able to handle it. And I do have a number for Penny. If it's okay to share, you can call Penny at 1-844-844-8040, and that's Monday through Friday, 8 a.m. to 7 p.m., and then on Saturdays from 8 a.m. to 1 p.m. And so that open enrollment, again, is ongoing. It started at the same time as the health insurance marketplace, but it is extended because it's new information through January the 15th. And so you have that time to select, to contact them and get information about enrolling into the new state-based exchange.
Thank you.
You're welcome.
Connor, do you have any other questions?
Yep, it looks like we have two more that have been submitted. Benjamin from Chester County wants to know, I have drug coverage from the VA. Do I need to sign up for a Part D plan as well?
Hi, this is Sharon. Let me see. Monique, were you able to weigh in on this question?
Sure, that's a great question. Coverage from the Veterans Administration is considered to be creditable coverage for Part D purposes for Medicare, which means it's seen to be as good as Medicare or not, or better. So you are not required to take a Part D plan. It would protect you from any penalties you would have for not having Part D coverage or comparable coverage. However, depending on the medications you're taking, you may find taking a Part D coverage plan to your advantage, but you're not required to. Part D is optional. No one is required that they have to pick it up. However, they don't pick it up when they're first eligible and they don't have other coverage. They may face a penalty and may not be able to sign up when they want to, should they need to pick up a Part D plan at a later time. But there are individuals who only get their prescription drugs through the Veterans Administration, and that is fine as well. Thanks.
Thank you. And it looks like we've got one more that's been submitted from Eleanor in Malvern. She asks, what is the difference between Medicaid and Medicare?
Well, Eleanor, that's a great question. Medicare is health insurance for people primarily age 65 and older, and for certain people who have been determined to be disabled by Social Security. Medicaid is health insurance for people of limited income, and you would apply for Medicaid through a local county assistance office. It's a joint program between the state and the federal government, whereas Medicare is administered solely by the federal government.
Thank you. And that looks like all of the questions today from the queue.
Awesome, Connor, and thank you so much to everybody who's on the line helping answer these questions. As we can all tell, this is it's a process to navigate, and we are very appreciative of the experts, and definitely have gotten a lot of great information from this conversation and lots of good resources as well in terms of websites and phone numbers and that sort of thing. So thanks to Sharon and Ed for joining us today and for their teams as well. We're very, very appreciative to you, and we're also appreciative to our callers as well and those who wrote in with questions. We normally have a pattern where if we are not able to get your call on the line, we will respond to you within 48 hours. It looks as though in this particular case that we've been able to answer all of the calls that we had either in the queue or submitted, but that is normally our MO. What I wanted to also say is it's very important for us to have these conversations about this enrollment period, of course, particularly before the enrollment period closes, and we will hopefully do this again at the same time next year as well. Please do make sure to reach out to us or to any of the resources that we've provided during this call with further questions. Also, please stay safe and have a wonderful holiday season. And the last thing that I'll say is that the transcript of this will be posted as well as sent out to people. So if for whatever reason you happen to miss this, please don't worry. We'll be able to send that out to people as well. Thanks one and all for joining us, and have a peaceful holiday season.
Thank you very much.
Thank you, Congresswoman.